This training session focuses on improving the involvement of older carers in hospital discharge. It's being funded as part of the 2024 to 25 Older Carers project, funded by Welsh Government and delivered in partnership between Age Cymru and Carers Trust Wales. The aims of this session are to increase awareness of the role of older unpaid carers and increase positive experiences of hospital discharge for older people and their loved ones. These aims are important because the point of discharge for a patient from hospital is often when many people become unpaid carers for the first time, or when they have additional caring responsibilities, there's change, or sometimes that caring role can reduce if the move upon discharge is into residential care. Age Cymru and Carers Trust's work shows that ongoing pressures on the health and care services since the COVID pandemic have seen unpaid carers face additional challenges and demands with the care needs of their family and friends over and above what they were facing before. Following this training, you should understand the role of older carers in hospital discharge and help to improve safe discharge and reduce the chances of readmission. The hospital discharge process is a stressful time for families, the patient, and can crystallise issues across the broader health and social care systems. Involving unpaid care as well in care and discharge planning gives a better experience for everyone and results in improved health and well-being. By focusing on the needs of unpaid carers who have often been caring for the patient for a long time and often without any outside help, this allows unpaid carers to carry on caring without adversely affecting their health and well-being. This more holistic planning means that reductions in readmissions can be reduced. It's important to stress that planning for discharge should be happening from the moment that a patient is first admitted to hospital, and this session focuses on what is needed for safe and timely discharge. Identifying older unpaid carers early has many benefits. They hold vital information about the patient that isn't in medical notes. Unpaid carers have a wealth of knowledge on the patient that can help with their care whilst in hospital and in planning for discharge. They can help with things like avoiding deconditioning, their daily habits, their interests, and the home life that are vital to the patient's ongoing care. Depending on their own circumstances, such as work and family commitments, some will want to carry on with aspects of their caring role whilst the patient is in hospital. For example, understanding the routines that unpaid carers use to help people living with dementia take medication and understanding their nutrition habits can help reduce deconditioning whilst in hospital and so reduce the time that they need to be in hospital overall. Involving unpaid carers helps reduce demand on health and social care services. Knowing what areas of ongoing care unpaid carers can give help with reduces overprescribing care, and if planning considers the wider community help from family and friends. If unpaid carers are involved early, it helps them plan better what they and the patient's community network may be able to do to help with this. Chances of readmission are reduced through more holistic planning. Understanding the needs of older carers is part of this. We hear from older carers who don't know where to go for advice and information on things like changes in medication and are worried they're doing the wrong thing, or who to contact about the care coming in from health and social care. If unpaid carers are better identified and involved, they can get help to keep themselves well and so provide better quality unpaid care for longer. Putting all these aspects together, involving older unpaid carers improves their own and the patient's quality of life. Excuse me. This slide details rights under the Social Services and Wellbeing Act, Wales 2014. If older people don't recognise themselves as a carer, they can't possibly access the help they are legally entitled to or access wider help that allows them to carry on caring and keeping healthy and well. The Act marks a shift in Wales by giving carers equal rights to assessment and support as the person that they care for. The Act emphasises a person-centred approach, requiring local authorities to assess the needs of both the carer and the person they care for and to provide care based on their own needs and well-being, independent of the person they're caring for. And around hospital discharge, this means that unpaid carers must be involved in decisions that affect their role as a carer. The following video covers many aspects around unpaid carers, those focused on GP practices.
One question from a healthcare professional can change an unpaid carer's life. The question is, are you looking after someone? It's simple, isn't it? So simple that it's easy to overlook. It might only take a few seconds of your working day, but it could help an unpaid carer to access support that will change their day for the better every day. There are more than 370,000 unpaid carers in Wales who form a crucial part of our health and social care system, saving the Welsh economy £8.1 billion a year. It's important that they can access the support they need to provide good care and look after their own health and well-being. An unpaid carer is someone who looks after or gives help or support to family members or friends with physical or mental ill health, disability or problems related to old age. Carers provide emotional, physical or practical support, often all three, for someone who would not be able to manage without them. On a day-to-day basis, an unpaid carer might do things like manage medicines, provide personal and intimate care, manage challenging behaviours and complex needs, cook meals, and provide emotional support. Many older carers give support all day, every day. Sometimes they can become physically unwell themselves, feel stressed and overwhelmed, and neglect seeking treatment for their own health needs. Older couples may care for each other and sometimes care for another member of the family too. It's important to recognise that an older carer won't always think of themselves as a carer. An older carer may come to your surgery alongside their spouse with dementia or their adult child with complex needs, or both. They may not ask for the help they need because they don't realise they have the right to an assessment for support, or that there are services out there to help them. You can make a difference simply by asking, are you looking after someone? And knowing where to direct older carers for more information about their rights and the support available. Under the Social Services and Wellbeing Wales Act 2014, carers have the right to receive information, advice and assistance from their local authority about support services like practical help at home, support groups or counselling to help deal with stress. These can be provided by different organisations, not just the local authority. Have a carer's needs assessment if their needs cannot be met by information and advice, and to have any eligible needs met, the same as the person they care for. Taking a break.
Older carers are the largest unpaid caring age group across the UK and in Wales. And without the huge volume of unpaid care they give, our health and social care systems would fall apart. That video just really shows the range of things that are going on. Ooh. This training focuses on older carers. Welsh Government's definition of older people is those aged 50 and over. But it's important to recognise that older people category includes several generations, the wide range of lived experiences and levels of health. And the statistics used for this slide are taken from Carers Trust and the Office of the Older People's Commissioner from Wales. In terms of their own health, older people are more likely to be living with one or more health condition and are at increased likelihood of living with dementia, and are also more likely to be living with sensory loss. Research shows that unpaid caring adversely affects both physical and mental health. Older carers are more likely to be sandwich carers, which is caring for a partner, parent or sibling, as well as providing childcare for the childcare. Older carers are more likely to be co-caring, which is caring for each other, which are particularly like to happen around things like sight and hearing loss. And so understanding the unpaid carer's own health is really important. Older people are more likely to be digitally excluded. So it's important that they have access to offline information. The last census data was taken under lockdown conditions, so it's taken longer than usual to get a detailed picture of caring across the UK nations. And within Wales, there are increasing numbers of unpaid carers in rural areas where it's more difficult to get outside help, and also in more economically deprived communities. Social Care Wales estimate that the percentage of unpaid care, percentage of care and support at home is 96%, and without that level of care, our care support systems would simply fail. It's 55% of carers that are aged over 55. Older people make the high proportion, but the average age at which people become unpaid carers is often earlier. There are also differences in the proportion of unpaid carers that are men or women. Working-aged women are more likely to be unpaid carers than working-aged men. In Age Cymru's annual survey, we're seeing an increase in caring by older men in later years. And as an additional piece, it's almost 42,000 unpaid carers in Wales that give over 50 hours of care a week. And in our 2024 survey, we saw a huge increase in the number of older carers that found caring a challenge over previous years. Here's some information from our annual survey in 2024, with over 1,300 respondents, and of those, it was over 400 carers. So this is a snapshot, not enough numbers to be counted as statistically reliable, but it's a snapshot of what we're seeing for older carers in Wales. And the nature of our work is that we tend to hear when things have gone wrong rather than when things have gone well. And we do take that into account in our work. This range of challenges indicates that many areas of older people will need help for to overcome. So when planning hospital discharge, these factors are important to consider. A third of older carers were living with a disability according to the Act. So it's important to consider whether you know a partner, spouse, family member or friend can actually provide for the older person's discharge. It's really important that discharge is planned early so that they can make the arrangements they need to, and then they are free for discharge meetings and discussions. 5% told us they couldn't work due to their caring responsibilities. The flexibility to meet changing needs and fluctuations in health mean paid work isn't possible for some. With many still working, how they can be there for hospital discharge needs consideration and clear communication. 37% of carers told us they found it difficult or very difficult to make healthcare appointments. As an example, we hear how post-discharge that older people haven't been able to follow up on medical advice. If the care for has new medication, it can take a while to get a GP appointment and have a medication review. So making sure discharge information includes all the right contact numbers to help with discharge recovery is really important. 54% told us that they found caring a challenge. This is a large increase since last year's the 2023 survey. This may mean the older unpaid carers simply can't provide the same amount of help as before, or it may be that they've reached the point where they don't think they can carry on caring at home. It's vital that opportunities are made for open and honest conversations on expectations post-discharge. Understanding likely recovery time, what help can be made available, and when that help is available really do help them plan. Older carers were more likely to tell us that their house was in need of repair, that they struggled with transport, they miss seeing family and friends, and that their mental or emotional health is a challenge. These are wider areas from annual survey that show what else the unpaid carer is often dealing with in life. And it's important to know whether the home is safe for them to return to. Local authorities have arrangements for adaptations, but trip hazards, inability to keep warm or mobilise for basic needs around the house can all mean that things can go wrong after discharge. Where the patient needs residential care after being in hospital, it can take time to find the right place that is within travelling distance of the unpaid carer. And in the survey, only one in 5 had asked social care for help. So that seems to indicate that there are many unpaid carers that have been missing out on important sources of information, advice and support available through local councils through Social Services and Wellbeing Act. We also heard through our survey about older people delaying their retirement because of the cost of living, whilst also trying to care for a family member. What carers have told us in their own words says an awful lot more actually than all those statistics we've covered. Lost older family members, had to care for a sibling due to health issues and a lack of carers available, not being able to work, difficult to get doctor's appointments, blood tests, no NHS dentists, no money, no local banks closing, no local cash points, no reliable bus service, not enough bus journeys to access other towns from small rural village, not able to afford a home broadband, food prices too high, high electricity costs. As a carer for two parents with dementia, the impact on mental health has been awful. A lack of support from LA until crisis point, having to fight for everything constantly, giving up work to maintain my own mental health and ensuring my parents were cared for, putting my own future financial stability at risk. I lost my job as caring had to take priority. Although Dad is now in a care home, I still need to be available for his regular hospital admissions. I'm unable to work or sign on as I'm not available for work. I'm 64 and very worried about the future. This and the next slide detail processes that should happen around discharge. They are taken from Carers Wales and Carers Trust Wales Good Practice for Hospital Discharge Guide. Not all staff will hold responsibilities around these, but these are important areas to know. Following the identification of an unpaid carer, relevant information should be recorded on the carer module of the electronic patient record. It needs to be on the records, otherwise carers can be missed in discussions, and if details are recorded, it cuts down on time the carer repeating the same thing to multiple health professionals. Having to repeat the same thing comes up a lot through our engagement with older people across Wales, and they tell us of their concerns that they may have missed something through, mistelling something through the exhaustion and repetition. Clinical staff should involve carers in the patient's what matters to me conversations on admission and on an ongoing basis. This links in with how important it is to have that voice there in discussions. And as mentioned earlier, they have a right to be involved in decisions that affect them under the Social Services and Wellbeing Act. Unpaid carer voices should be incorporated into multidisciplinary team meetings discussing discharge, either directly or through representation by a carer support service. It may not always be possible for carers to be there at every meeting, but that voice needs to be heard. This links in with the previous point and is about ensuring those conversations are embedded in discharge and care planning processes. All clinical staff should be familiar with the process for ongoing onward referral of carers to the on-site carer support service. How this is arranged can vary from setting to setting. It's needed to give older unpaid carers access to help that's available. Discharge plan provided to the unpaid carers. We know this can change, but it's important that things they need to consider are included in this. Things like travel arrangements, timings, when reable care will be visiting, who to contact for different things, and all those things really matter, as carers also have to consider their own daily lives and responsibilities aside from their caring role. Hospital staff aren't expected to know everything, but knowing where to signpost and where to refer is important. Carer support services have a lot of information on carers. The national organisations on this slide work in different parts of Wales. The training pack accompanying this training includes handouts that include national and regional information. We're now going to look at two examples of unpaid carers in different circumstances. Ask yourselves these questions, note them down on a piece of paper as we go through. What role can unpaid carers play whilst the cared for is in hospital? What role can they reasonably play in planning the discharge? And a third question for you to take forward from this training is to ask yourself, what can you do in your role to improve positive outcomes in your working practices? Lived experience, Davith. Davith's dad Geraint is 80 and he lives on his own in a second floor flat. He has mobility problems and other serious health conditions. Davith works full time but helps his dad get out and about and around the house. Geraint is in hospital following a scheduled hip replacement. So that first question, what role can unpaid carers play for whilst they're in hospital? Well, with Davith working full time, it's more difficult for him to be there in the day, but he could be reached by phone or email so that he can respond to when he's got time. He'll know whether his dad's wider health needs are increasing with having looked after him for such a long time. What role can they play in planning for discharge? You'll need more information on this to help you understand what Geraint needs for a safe discharge. If there's no complications, it could be a relatively simple discharge arrangement. But Davith will need to know whether his dad will be mobile enough to feed himself unaided, whether he will need any personal care, and whether there are any medication needs, as well as other things. Depending on the size and accessibility of Geraint's flat, he may not be able to go back there straight away. It's possible with the recovery expected that Geraint can be discharged to Davith's home, but Davith's family need to know the details before they can agree to that. Again, it's worth remembering that unpaid carers are under no obligation to provide unpaid care. And if Geraint's wider health conditions are deteriorating, his flat may no longer be suitable, or it might need some adaptations in place before he leaves hospital. And it depends on how much income Geraint has, whether he can contribute to those costs under social care funding legislation in Wales. So access to the information on finances is vital. If Dad needs care as well as a rehabilitation package when he comes out of hospital, and Davith is willing, he will need time to arrange taking time off work. Or if not, time is needed for social care assessments to be done and packages available for when he leaves hospital. It's important that social services are aware early enough to plan for that ongoing care package. Older carers have contacted us to tell of the distress it causes when they're working during the day and they get a call saying Mum or Dad has been discharged today, and they've no chance to finish work, do some shopping, put on the heating, change the bedding, and all those things that are needed after a hospital stay. We also hear from others who have had to have urgent time taken away from work to care for a patient whilst their other parents are admitted to hospital. Okay, so now we're moving on to Sian and Rhian. Sian and Rhian are both carers for their mum, Nerys. Nerys has lived alone since her husband died 18 months ago. She's living with dementia and increasing sight loss. She was admitted to hospital following a fall. Sian works full-time and Rhian works part-time. Rhian is also a carer for her adult son with a learning disability. So there's questions again. What role can unpaid carers play whilst the cared for is in hospital? Well, depending on availability and times, this could include increased visiting times to reduce the stress on the patient. Their own commitments may not make this possible as much as they want or at all, but telephone conversations with staff around Nerys's routines on diet and medication can help. And what role can they play in planning for and discharging a patient? Depending on Nerys's degree of memory and sight loss, discussions with Sian and Rhian are vital to understanding whether it will be safe for Nerys to go home. If Nerys has the capacity to make decisions for herself and wishes to go home, it's important to get a clear picture of how much help Sian and Rhian can continue to provide and what outside help is needed for Nerys to go home safely. Having provided lots of help for Nerys, they'll know about her community networks and whether friends can help at home or whether more formal care is needed. This will include things like meals at home, cleaning, aids and adaptations, medication needs, domiciliary care or a personal assistant through direct payments, care around her dementia, care around her sight loss. And if Nerys is not safe to go home or needs longer to recover before she can go home, then arrangements for short-term or long-term residential care need to be made. Under the Social Services and Wellbeing Act, the charges to a patient can change according to whether care is provided at home, whether it's short-term care and whether it's long-term care. Support is often needed to understand the complex charging arrangements, so those links to organisations that can help are really useful at this point. This is the end of the training session. It'd be great if you could use that last question. What can you do in your